안녕하세요. 미국 간호사 써니입니다. 오늘은 제가 리포트 종이를 작성하는 방법을 여러분과 공유하려고 해요. 한국에서는 전산으로 리포트를 다 받아서 딱히 리포트 종이를 작성을 안 한다고 들었는데 미국에서는 리포트를 컴퓨터 스크린을 보면서 받기도 하지만 대부분 스크린을 보면서도 종이에 다 일일이 적어요. 저는 받아 적으면서 외워지는 편이라서 그게 딱히 불편하지는 않았어요. 리포트 종이 형식도 병원마다, 병동마다 다 다른데요. 저도 이것저것 다 써봤는데 오늘 제가 보여드리는 방식이 저한테는 제일 편하고 맞아서 이렇게 써요. 여러분도 이것저것 해보시면서 자신한테 제일 맞는 방식을 찾으시면 돼요. 시작하기 전에 오늘 들려드리는 환자는 허구의 인물임을 알려드리고요. 제 이전 영상 영어로 리포트 주기 첫 번째 영상에서 다른 환자분의 내용을 똑같이 따왔으니까 좀 더 자세한 설명이 필요하신 분들은 그 영상을 참고해 주세요. 링크는 위에 달아 놓을게요. 자, 그럼 바로 시작할까요? All right, this is Mr. James Lee, 64-year-old male. Patient of intensivist and general surgery. He's a full code and allergic to penicillin and amoxicillin. He has a past medical history of ex-smoker, COPD, which he wears 2 liters nasal cannula at home, PVD, and OSA, which he wears CPAP at night. He came to the ER on the 1st of April with nausea, vomiting for 3 days. They did a CT of his abdomen and found a small bowel obstruction. He was stable at that time and went up to the floor with an NG tube and was put on an antibiotic. On the 2nd, he went to OR and had an X-lab with small bowel resection. During the surgery, he lost about 300 ml of blood and became hypotensive. They gave him 4 PRBCs and 3 liters of NS. He came to us intubated at 4 p.m. and was stable overnight. Today, he passed his SBT and got extubated at 1100. PT and OT worked with him, and he was up on the chair for about 2 hours this afternoon. He used a walker during therapy. Plan is to keep him in our unit overnight to make sure he stays stable and transfer him to the floor tomorrow. Neuro-wise, he is alert and oriented ×3 and very pleasant. His grips and pedal pushes are strong and equal. Perla, pupils are equal, round, about 3 to 4. He tracks just fine. He gets up with a walker with 2 assists. Cardiac-wise, he is in normal sinus rhythm with some PVCs. Heart rate is 70s when he's resting and goes up to 90s when he's up and moving. Blood pressure has been 110s to 130s, and parameter is to keep systolic under 140. Pulses are strong in both uppers and lowers, and heart tone is normal. Cap refill is less than 3 seconds. Respiratory-wise, he's on 3 liters of nasal cannula right now, but needs about 4 liters with activity. He uses his incentive spirometer and pulls about 1,000 to like 1,500. Goal is 2,000. Lung sounds are clear over diminished, and Tmax was 99.6 orally. GI-GU-wise, his belly is soft, round, and tender in all 4 quadrants. Bowel sounds are hypoactive, and his last BM was on 30th of March. He has an NG tube to LIS and it put out 150 out for my shift. It is bile watery. He had a urinary catheter or a Foley until I removed it at 5 p.m. He put out 500 mils before I pulled it. He's NPO with ice chips for comfort. I've been giving him some mouth swabs as well. Skin-wise, he has a midline incision with staples. 4x4 and tape is on, and it is clean, dry, and intact. His bottom is a bit red but blanchable and has a metal-like sacral border on. IV and drip-wise, he has an 18 on his left AC, and NS with 20 FK is running at 75 mils an hour. He also has a 20 on his right upper arm. Lab-wise, he's on routine potassium replacement protocol, and his last potassium that I just got is 3.3, so I will replace it before I leave. His white count is 14, and creatinine was 1.4 this morning, which improved from yesterday. That is it. Any questions? 오늘 영상은 여기까지예요. 여러분들도 들으시면서 따라해보세요. 계속 연습하시다 보면 어느새 익숙해져 있으실 거예요. 오늘 영상이 도움이 되셨다면 구독과 좋아요, 알림 설정까지 꼭 눌러주시고요. 저는 다음 영상으로 돌아올게요. 오늘 하루도 건강하시고 화이팅 하세요. 감사합니다.